The closing of a mental health center in the South has been an issue for years, especially in rural areas. Many of those centers are trying to help people with their problems. Today, state officials were in Brantley to break ground on a new crisis center, which is part of the state's efforts to increase crisis mental health care across the state. WSFA 12 News reporter Julia Avant has more.
The City of Brantley showing up in a big way. They're celebrating being the future home to the first ever rural mental health crisis center in the state.
The health care crisis in this country is overwhelming, and this crisis center will meet a need that has desperately been made visible.
Executive Director of Future South Central Alabama Mental Health Center, Tommy Wright, has been advocating for care like this since 2020. It's being made possible with local and federal dollars through the Southeastern Crescent Regional Commission.
So if you're in a crisis, this will be the place to go. If you need help and you're in a crisis, this is where you need to go.
The 21,000 square foot building will have areas to treat and evaluate those in need until they're ready to return to everyday life, a method that has been proven effective since opening 6 other centers statewide and the 988 hotline that launched in 2022. According to the Department of Mental Health, the hotline has helped over 100,000 Alabamians, and the centers have cared for those in crisis and prevented thousands of suicides, something Governor Kay Ivey says she has been pushing for since her first day in office. But it wouldn't have been possible without the small town.
But we have to give credit where credit is due. The town of Brantley has been instrumental, providing 4 acres and $3.1 million in infrastructure support.
Construction is expected to begin in January. They hope to open their doors in 2026. In Brantley, I'm Julia Avant, WSFA 12 News.
Again, there are 6 other crisis centers run by the state government all across Alabama, including one here in Alabama. Those crisis centers meant to provide a location for people in crisis to go, as opposed to being sent to jail or an emergency room.